Hi students at RCSI Perdana Family Medicine, First Rotation Group E. Selamat datang ke Jabatan Perubatan Keluarga. There you go. I hope that you will find this a stimulating and valuable clinical attachment in family medicine. Now, you are unfortunate in that there are 2 national holidays within the first week. And ordinarily also, because we have a whole day at Hospice Malaysia on the Thursday, and also time for clinical skills updates and video consultations at the CSU, plus a half day for the augmented teaching practices with the GP tutor. That leaves you effectively with only 1 half day for class-based teaching. So therefore, we are providing most of the teaching online, and there will be some face-to-face classes also on the Tuesday morning, Tuesday the 13th of September. During each of your 5 weeks of clinical postings in the GP clinics and the Clinic Kesehatan and HKL OPD, we will have a midweek review at Grand Seasons Academic Centre on Wednesday afternoon. We'll also have case presentations on the Friday morning of each of those weeks. Because we are limited in the amount of face-to-face teaching we can do in the first week, we will use the afternoon of Wednesday the 21st of September to focus on the Moodle curriculum and the teaching. So already some of the videos have been uploaded and more will be before the beginning of term. It is mandatory that you look at these before you attend class. Okay, so outline of week 1 is campus-based teaching, which will be mainly at GSH and some at PU. The video sessions and clinical skills updates are always based at PU. We also have a set of online pre-course MCQs, and because of the nature of this first week with its 2 holidays, we have already set this up to run from 7:30 p.m. to 8 p.m. There are 20 MCQs and you'll have 30 minutes to complete it. It is single best answer format. You will be given your result immediately on completion. Most classes that we will teach face-to-face will be interactive style. The content is available on Moodle, some on video, but all on as PowerPoints, and you're expected to have read them beforehand. In that way, you will glean a lot more from the class by getting involved in the questions and answer format. The health promotion class, however, is unique in that it will be presented by yourselves. You will collaborate with each other to produce a video about a patient attending a GP who needs to make some lifestyle changes. This has been very popular with the students, and it's been a much better learning and teaching experience than the traditional didactic lecture, which everybody found was too boring. This is set up for a Wednesday afternoon of your 3rd week, your 2nd clinical week, but that's open to change if need be. For the video consultation classes, you'd be well advised to click here and look at this on the Calgary-Cambridge model of patient consultation. There is also a dedicated PowerPoint presentation on Moodle about the Calgary-Cambridge. You should certainly look at this, because what it's about is about helping you to see the consultation from the patient's point of view. The patients come with symptoms of an illness, not with a disease. The disease model is the doctor's kind of area, doctor's arena, but the illness experience is the patient's, and good doctors will see things from both angles. As well as the video sessions, which you'll do individually, and then we'll have group discussions afterwards. We also have OSCE style clinical skills updates, but these have immediate feedback, verbal and written. These are run exactly as your year-end OSCE, in which you will be asked to assess various physical examination skills and practical procedure skills. The OSCE sheets with your feedback are yours to keep and to practice on. And again, I would stress that the students who do this, the students who practice on these sheets, are the students who do well in the end of year OSCE. They have no hesitation. They're confident because they know exactly what they're doing. So A word of advice at the outset of the year: please do practice from these sheets. We'll also have a session on opioid addiction delivered by a former addict and dealer who's now fully rehabilitated and running his own service. Throughout your rotation is a major focus on communication, professionalism and evidence-based medicine, not just in the first week. So in broad outline, this is the sort of things that you'll be involved with. And some of these have already been delivered as videos and uploaded. The dermatology will be delivered by Dr. Leong Kin Fon of Hospital Kuala Lumpur. Pretty much all the others will be delivered in-house, apart from this one by Michael Chow, care of opioid addicted patients. We have a dedicated session on apps and medicine, and this has now been converted to video in case there's not time to deliver it face-to-face. A new development since last year is the key feature problems analysis, which we will go through in the first lecture, but it's also now available on YouTube as a dedicated video. The core texts for your 7 weeks are primarily the Oxford Handbook of General Practice, which is available both online via PU Library, and this is the link to that, and also available as a book to buy, approximately 110, 105 ringgit from Kamal Bookshop in Jalan Pahang. Quick Medicine is a smartphone app which is covered in the Apps in Family Medicine video. It's available for approximately 4 ringgit 80 cent in Malaysia. It's very thorough and very worthwhile purchasing. It's available for both Apple and Android phones and tablets and iPads, etc. There's a core curriculum on Moodle which you should look at and review. The augmented teaching practices are to do with the Calgary-Cambridge model, as stated earlier. This is another link to that. And you'll attend them in week 1, where you will see a patient, and then you will go through with that patient his or her experience of illness. You will then present this later at the end of the session to the GP tutor. In week 7, you will present 2 cases to the same tutor, but these are cases that you have identified during your 5 weeks clinical posting. Your palliative care teaching begins in week 1. You're divided into 2 groups. One group comes on the 15th of September, the other group comes the following week on the 22nd. You will meet at Hospice Malaysia. Starting time here is 8 a.m., not 9 a.m. And then you will go individually with a palliative care community nurse to a patient's home or some patients' homes. From this session, which lasts the whole day, you will identify a patient that you will present in week 7 to the hospice staff and myself at Hospice Malaysia. The weeks 2 through to 6 are your 5 clinical postings. We attach in a variety of settings. Community health clinics at Klinik Kesihatan, and also GP clinics, and also the outpatient clinic at Hospital Kuala Lumpur. This will, at some point during the year, change over to being a Klinik Kesihatan, a KKKL. In each of these settings, you'll be attached to a doctor. Because we're splitting into 2 groups of 6 and 7, then there'll be enough doctors in each of those settings for you to have individual tuition and experience of seeing patients together with a doctor or on your own. And you will get experience in taking histories, in consulting, in examination, and in practical procedures. In the Klinik Kesihatan especially, there is structured care, so there are lots of hypertension and cardiovascular risk clinics, general non-communicable disease clinics like diabetes, asthma, COPD. There's also communicable disease clinics like TB clinics, STI clinics, HIV clinics, and there's mother and child clinics, medication review clinics in some but not all. In week 7, your final week, you return to the department where we will have a reflection on your experiences throughout the 7 weeks, a specific individual presentation from each student about their ethical challenges, and a final summary review of the evidence-based medicine sessions. Plus, you'll have an opportunity to finalize and submit your portfolio assignments, which brings us on to assessment. You're assessed basically in two ways: at the end of rotation through your assignment portfolio, and at the end of year through these three: MCQ, key features paper, and clinical OSCE. For your assignment portfolio, all assignments must be submitted, not just the summatively marked ones. And for the others also, the clinical OSCE is a must pass. So failure to submit and failure in the OSCE will lead to failure overall. That means that you will then have to resit and your marks are capped at 50%. You cannot achieve an honours grade. Attendance is compulsory. You can't excuse yourself because of family weddings or trips away. It's not acceptable. You must turn up for your classes and your clinical postings. Please check everything on the Moodle calendar and make sure that you have checked the location of your various clinical postings so you know where you're going and that you arrive on time. Please make sure you behave yourself impeccably during your clinical posting. Confidentiality is a must. Please dress appropriately. If you have any concerns about the standard of your teaching in the clinical postings or anything about the department, please contact us by email, phone or WhatsApp. And the sooner you do that, the better. We welcome you to the department and we wish you a very fruitful and positive learning experience throughout this rotation. Thank you.